Okay, hi, Dr. Dave Webster. This is my introduction to the part 2 of the two-part series on the impact on our patients of the lack of access to PET-CT in Ontario. By the time we finish this part 2, I'm going to cover at least 5 different negative impacts that it does have in our patients. There are many more, as I will show you in subsequent blogs. Now, in addition, I'm also going to hopefully launch my YouTube channel to you. I hope this is going to be a more effective way of communicating with you and getting some feedback and suggestions for improvements, video topics and so on. But keep in mind, I'm just struggling to learn how to do that. And any suggestions you can make as to how to make this thing work would be much appreciated. I'm also struggling with, software to make these movies and so on. And I mean, I know I should just take the time and read the manuals or learn how to use it, but I'm a guy, first of all, and secondly, I'm the kind of guy who would take a time management course if I had the time. So the most important thing, as I've said, and the most critical for me really is to get the feedback from you, and my apologies for the filming issues, but bear with me as I learn. But I'm also going to try and find a more effective way of indexing these videos to make them more powerful and useful and accessible. And but organization is not my greatest strength. Just ask my wife. But also, I struggle with the content and style of these videos and comments because I'm a very passionate person about this topic, and it's got me into trouble in the past. But also, I found that some people aren't actually comfortable with someone who's very emotional, or not emotional, but passionate about these issues, even if what I'm saying is true. It's been a hard balance for me to reach between what is unbelievable lack of cynicism and lack of trust and respect for our politicians and their bureaucracies over these past 15 years, particularly when you're sitting in front of all the patient casualties that they simply, as you will, I think, see, they could care less about. So my plan, really, through these videos and so on, is to just give you the facts so that let you make up your own minds. I think you can connect the dots for yourself. And if I'm straying too far from this principle, just let me know. Now, also, if you don't already realize, I don't have lots of videos on this, but every so-called fail-safe watchdog system in Ontario that is in theory supposed to be there to prevent you from abuses such as this by our politicians and their bureaucrats and their experts and so on has, as they say, has been bought and paid for. But it also makes very clear the risks that I'm taking, because there are a lot of very powerful people in this province, not just politicians, and that do not want you to have access to this information, will feel threatened by it. They don't want you to see the really very thin veil of so-called our open, transparent, and accountable democracy in the place we call home. But we do have an election coming up, and I think it's a unique opportunity. I don't need to tell you, I'm sure, that unless we do everything we can to make sure that this issue is discussed as one of the key election issues. It's obviously not the only one, but it does need to be a key one, I hope, because I can assure you that none of the candidates, regardless of which party they represent or the party of the people or whatever they want to call themselves, will touch this critical topic. And this is especially critical at this time with our aging population, of which I am part of course, because of the cost implications to those who are going to have to pay for this and so on. It's an enormous problem. But this does offer some interesting and amazing solutions, which are not just a better healthcare system, but actually cheaper. But if this doesn't lead to actions, then it's just not going to work. I mean, I've been doing this for 15 years, and it's absolutely clear to me that the only way that change is remotely possible is if we use the power of social media to demand this change. And so I'm going to need all the suggestions I can to keep this issue as a big and upfront issue and center stage as I can. But if this doesn't lead to some sort of discernible action in the next few months or so, I'm just simply going to have to give this up. I mean, as I've said before, I am literally being threatened not just by the Ontario government, but Cancer Cure Ontario, and sadly my own College of Physicians and Surgeons, as you will see, because I'm even bringing this information to your attention. I mean, there's an election coming. They've got real need to try and shut this down. So, I mean, if this is not the kind of place as you watch these videos and see what's happening, the kind of place you think Ontario really is, or you want to raise your families in, or more importantly, if you just don't want these kind of people making such critical decisions about your health care, and of course they make decisions about many other important issues as well, this has to lead to some change. And that change absolutely has to be that we need a system that absolutely you make sure that our politicians, their experts, their bureaucrats, and so on are absolutely 100% held fully accountable, for their statements and their actions. Otherwise, we're just basically a banana republic, and maybe we're actually there. I think you'll see maybe in some ways. Now, of course, most of you know better than me how to get this out as widely dispersed as possible for the public and information. And my goal will be, who knows, one day that something I've said here, some video I've made will actually go viral, because if that does, what it may actually do is finally force one or more of our so-called trusted professional, quotes, sources of news and information, that they'll be forced to actually cover the kind of what's happening, the information I've been giving them for this entire period of time, as you won't be surprised to hear. So thanks for watching, and please get this as widely distributed as possible. I hope you find it interesting what I'm saying, but more importantly, disturbing enough that you want to be part of bringing about and forcing a change in the place we all call home, and that is Ontario. Thanks.